This hearing is being held by the Department of Public Health in accordance with sections 4-168A1F and 4-168B of the Connecticut General Statutes. The purpose of the hearing is to allow all interested persons the opportunity to verbally comment on the proposed regulations pertaining to nursing home staffing ratios.
I'm CEO of Ryders Health Management. We own and operate skilled nursing facilities in Connecticut. I'm also a registered nurse. And I'd like to say I agree with almost everything I've heard today. We certainly support the staffing ratios, have always. And in fact, we have always had ratios to that level or in excess of that in our company. The challenge is no matter what staffing ratios we mandate, many others have said this, there are not enough resources. We advertise 7 days a week, 24 hours a day. We're actually offering sign-on bonus as high as $10,000 to get a nurse into the building. We can't get them. Others have touched upon a detriment to the goal of providing quality of care. We want to do that. The nursing agencies and nursing pools in the last 12 months have exploded. We have asked the legislature for assistance to deal with this crisis. We hire a wonderful nurse's aide, and within a week or two, the pool recruits them and they're gone. The nurses' agencies that send staff frequently do not care about the patients and do not show up if they don't want to. We have no recourse. Now, if you could put the staffing ratios to 10, it will not change the labor shortage and the crisis we're facing with these nursing pools and nursing agencies. If we don't address the root cause, no matter what mandate you put out there, it's just going to create more shortages, more penalties that we can't address. We are shutting down admissions in our buildings every day. I know one legislator on the call said she was a businesswoman. Would you like turning away customers because you don't have enough staff? That's exactly what we're doing every day. We want more staff. We need more staff. I do disagree with some of the things that were said on the call earlier. Physical therapists do provide care in the morning. They go to patient rooms. They do hands-on care, which is part of the rehabilitation process. And many of these have master's degrees and PhD physical therapists. But the way the separate ratios for nurses and nurses' aides will result in a reduced quality of care. In order to fund the increased nurses' aides, we may have to reduce nurses. And someone spoke earlier about resources. The industry estimated an implementation cost of $77 million. The DSS put in $500,000. It's unsustainable. It's insincere, frankly, and I'm glad somebody from OPM's on the call because we've seen over the last 2 decades the right size and rebalancing initiatives that have reduced dramatically resources to skilled nursing facilities. I don't know if that was the intent, but it certainly doesn't contribute to greater staffing in skilled nursing facilities and better care. Thank you.
That is time. Oh, perfect timing. Thank you, Martin,
Yes.
for that.
Thank you.